Hey, welcome back to Not So Complicated, and today we'll be talking about every important triads like Burkow's triad, Charcot's, Murphy's, Beck's triad, Kartagener syndrome, Felty's syndrome, Meigs, and Wernicke's encephalopathy. All right, so let's begin from Burkow's triad. It is about the risk of development of thrombosis, and there is these three corners and three different reasons. The one is stasis. Stasis is like the stoppage or slowing down of blood column, the movement of blood column in blood vessels. All right, so there are different reasons. We'll be talking about that later. The another reason is endothelial injury and hypercoagulability. All right, so the causes of stasis can be due to immobility, venous obstruction, varicose veins, atrial fibrillation or LV dysfunction, and low heart rate, low blood pressure, obviously, and congenital malformations. All right, so there are different reasons for endothelial injury also that can be due to thrombophlebitis, cellulitis, arteriosclerosis, and indwelling catheter, venipuncture, physical trauma, or stress or injury. All right. So talking about hypercoagulability, there is different reasons called like major surgery or trauma, malignancy, infection, sepsis, inherited thrombophilia, IBD, and autoimmune conditions. And talking about Charcot's triad now, it is ascending cholangitis, and the first reason is fever. All right, so there is the symptoms is fever. So the fever in ascending cholangitis, unlike cholecystitis, is swinging in here. There is swinging pyrexia and cholangitis. All right, so the other one is jaundice, and the other one symptom is right upper quadrant pain. So this is just a visual representation of jaundice right here. So if there are two other symptoms added to this triad like confusion and hypotension, then the triad becomes a pentad, and that pentad is called Reynolds pentad. All right, so that is about Charcot's triad. Now talking about Murphy's triad, it is for acute appendicitis, and we all know there is fever and nausea or vomiting, and then right iliac fossa pain. So this pain, it initially begins around umbilicus, and then it shifts towards right iliac fossa. Right, so there is a point called McBurney's point for an acute appendicitis. So this is the visual representation of McBurney's point. Like we draw a imaginary line from umbilicus to right axis, that is anterior superior iliac spine, and two-thirds from umbilicus to the axis will be making a point, and that is McBurney's point. The pain is maximum in that point. All right, so that is how we elicit the pain in acute appendicitis. So talking about Beck's triad now, it is for cardiac tamponade, and there are different symptoms called like hypotension and muffled heart sounds and raised jugular venous pressure. And hypotension, it is associated with narrowed pulse pressure actually. All right, so in muffled heart sounds, obviously it is due to fluid in pericardial space, and that is like this. There will be fluid, that can be blood also. All right, so raised jugular venous pressure, it actually looks like this. You can distinctly say that there is raised jugular venous pressure in a patient representing with cardiac tamponade if the presentation is like this image. All right, so that is about Beck's triad. Now talking about the Kartagener's syndrome. So Kartagener syndrome, the first symptom that we can talk about is dextrocardia and bronchiectasis, and then chronic sinusitis. So we'll be talking about this how this happen actually. So dextrocardia, obviously heart stays in the right side during embryogenesis, and how does bronchiectasis actually develop is that there will be no ciliary movements. All right, so that will lead to the mucus plugs, and that mucus plugs will favor the bacterial colonization and inflammation, and then these bacteria will lead to destruction and dilatation of bronchi, causing bronchiectasis. All right, so that is the pathophysiology of bronchiectasis in Kartagener syndrome. And chronic sinusitis, it is very easy that impaired mucociliary clearance will be there, that will cause repeated sinus infections, and that will lead to chronic sinusitis. All right, so this is the triad right here. So here is situs inversus instead of dextrocardia. It is because that if the heart is on right side, that is dextrocardia, but there can be a condition where there are like entire visceral organs in the alternate side. All right, so liver is on the left side, that is situs inversus. All right, so that is Kartagener syndrome. Now talking about Felty syndrome, it is a rare complication of long-standing rheumatoid arthritis. So the symptoms are neutropenia, rheumatoid arthritis obviously, and splenomegaly. So neutropenia, there, that is about the low levels of neutrophils, and that will lead to increased susceptibility to infections. All right, So, rheumatoid arthritis, that is obviously chronic inflammation of joints leading to stiffness, pain, and swelling. And splenomegaly is enlargement of spleen, alright? So, that will lead to like abdominal discomfort or early satiety. We can also remember about Felty's syndrome by a mnemonics called Santa. So, the talking about Santa has is splenomegaly, A is anemia, neutropenia, thrombocytopenia. So, all three blood cells, that is RBC, WBC, and platelets, will be decreasing, and arthritis. All right, so that is about Felty's syndrome. Now talking about Meigs syndrome, it is about benign ovarian tumor, and the symptom is ascites, ovarian fibroma, and pleural effusion. The first symptom is ovarian fibroma, and that will lead to hypersecretion, that is ascites, and then pleural effusion. Ascites can be infected or uninfected ascites also. So this is how transvaginal ultrasound image of adnexal looks like in adnexal mass and in normal conditions. All right, so that is how Meigs syndrome is actually. So there are variants of Meigs syndrome, and Meigs syndrome is about ovarian fibroma, ascites, and pleural effusion. As we talked about it, it resolves after tumor removal. But there is a something called pseudo Meigs syndrome, and that is about other ovarian or pelvic tumor, benign or malignant, and ascites plus pleural effusion. Similar picture, but not fibroma, right? So another one is pseudo Meigs syndrome, that is seen in SLE, that is systemic lupus erythematosus, and then ascites plus pleural effusion, and there will be no ovarian tumor, all right? So that is about Meigs syndrome. Now talking about Wernicke's encephalopathy or syndrome, that is obviously thiamine deficiency. The first one is ataxia. The second one is confusion and ophthalmoplegia. There are different manifestations of this. So the ataxia, it can be for a gait or a stance, all right? So the confusion, it can be disorientation, indifference, or inattentiveness. And ophthalmoplegia, it can be nystagmus, lateral rectus palsy, or conjugate gaze palsies, all right? So this is Wernicke's syndrome. There is mnemonic something called COA-MAC, all right? So this is for Wernicke's encephalopathy and Korsakoff's psychosis. The first one is confusion, ophthalmoplegia, and ataxia. That is for Wernicke's encephalopathy, acute. And Korsakoff's syndrome, that is for chronic, MAC, that is memory loss, especially recent anterograde amnesia, confabulation, makes up stories to fill gaps, all right? So that is the Wernicke's encephalopathy. Now, that is all for today. Please subscribe for more, and thank you for staying with me.